I'll say that the good news is that there already been talks and there are already like strives to ensure that the public and private partnerships exist when it comes to ensuring that people, Nigerians, can get access to health insurance or can afford health care in Nigeria, right? I think what really needs to be done is to have those policies enforced. It's one thing to have policies that exist, it's another thing to have policies that are enforced. So, how do you enforce them? Perhaps providing incentives, right, for the private sector to want to build the infrastructure, want to build the facilities, want to invest in talent, want to invest in startups, right? Those incentives. I'll give an example for the United States, right? For employers, it's by law that they have to provide some sort of health care coverage for their employees. Otherwise, there are tax implications like that. Tax implications that will receive if they're not providing health care for their employees. So, what can the Nigerian government or the African government do to implement and execute and enforce regulation to ensure that we have very stronger private and public partnerships to just to make sure that Nigerians can access and afford health care? On my previous panel, I was talking about how there are more women led startups building for healthcare in Nigeria than there are men. However, more men, at least the men, have received more funding than us, their female counterparts. Our male counterparts have gone on to raise $40 million, $30 million, $20 million, right? And I believe there's only one healthcare startup that is led by women that's been able to raise over $1 million, right? Still good, but like there are more women who need that funding to build those startups. Even if you think of like women, for examples, we're basically the chief executive officer when it comes to health in our home. So it's no brainer why you see more women building in the healthcare space, right? And so are women struggling to get that or to secure those challenges to secure that funding, and what can be done, like intensively done be done to ensure that women get access to the resources that they need, not even just the funding, but access to the partnerships that they need to grow and scale our business. And mentorship is also important, but if we do not have those three things, we're going to continue to encounter this statistics where we have women who are building healthcare startups, but are not able to secure the funding, the support, and the partnerships that they need to grow and build profitable businesses. I had the opportunity to go to a JP Morgan conference in January earlier this year in San Francisco. It is the largest healthcare conference in the world. And why it was very important for me to go was because sometime last year, I got to a point where I was very burnt out and I was very discouraged. I had been building Clafe for some time, and it just felt like I wasn't making any headway. I couldn't see enough success stories to point to and say, like, oh, I can be like her one day. I can build Clafe like this one day. And, I had the opportunity to go to this conference and I got to see the big either health tech startups, biotech startups, government, investors come together and they were just talking about all the work that they've done. I met the CEO of Teladoc, for example, and his story is very inspiring because he built his startup from the ground up. He talked about how he went to different health providers around New York, was knocking on their doors to bring them on their platform, how they spent a lot of money on marketing, and they've been able to build a very successful startup today, or the founder of ZocDoc. They're all male founded startups, but what was really good for me to see was that what it takes and what it looks like to build a successful, thriving healthcare, health tech company in an environment that works, that has great policies, that has the infrastructure that is needed, that has the talent, right? And I think for us, the opportunity that for us who are building on the continent have is that we can be more creative. We can leverage the resources that are there, right? We can learn from what's happening in the West, but adapt and build things that actually work for us so that we can have a healthcare system that we are very proud of, that we love, and that actually works. And if we're seeing people, our counterparts in like United States and the UK, reform their healthcare systems, I don't think we need to copy and paste that. I think we have a really great opportunity to just build something new that other people, like in the United States or the UK, can learn from us and then incorporate in what they're building in their own companies abroad.